well, let's move on to some segments. There's a lot of stuff to choose from this time. So this first segment is kind of fun, actually. This actually comes from a Huffington Post article, and basically the segment is the red flags of plastic surgery, how to spot them. I think we got a title thing, Prinny can throw it there. There we go, red flags of plastic surgery. You like that? That's totally not an AI photo.
Definitely not.
So I was looking through plastic surgery articles, and this one came from the Huffington Post, which sometimes will put out some good stuff. And so their article is titled, "We're plastic surgeons. We'd never overlook these 7 red flags." So basically, HuffPo got, yeah, there it is right there. HuffPo got, I don't know how many plastic surgeons it was, to make a list of things that they thought were red flags. So I thought it'd be kind of interesting to go over the list. I mean, you guys are, well, Sarah, you're a little ahead of Brenna, but you guys are both practically plastic surgeons at this point after being on the show for so long. Cool. So I thought as a group we could like go over their list and see what we thought about it, and then I definitely have some to add. Maybe you guys too. All right, so number 1 that they said is these are red flags. So this means like you're going to get plastic surgery consult, and this happens, and should you be alarmed? Surgeon not board certified in plastic surgery.
Yeah.
Absolutely. That would be my number 1. Like that, I was like, okay, this article's off to a really...
Yeah, that should be like the first thing you look for.
Yeah.
Before you go to the appointment.
Right. Yeah, 100%. So, Brenna, you haven't been here for many episodes. I'm going to give you this education here. So when you're talking about plastic surgeons and board certification, there's only one board. It's the American Board of Plastic Surgery. And if they don't have that, then there's just like no telling what they're training. It could have been nothing.
Yeah, they could just be like an esthetician.
Almost, yeah. I mean, I've seen, as I've said in the past, I do some malpractice consulting, and I've seen cases where you would be shocked at how little training somebody had, and they were doing plastic surgery. So that is the big one. I think that the article almost hits a home run just for having that one. American Board of Plastic Surgery, that's really, really big. Okay.
Yes.
Number 2, surgeon does not specialize in the procedure you want.
That's a good one.
What do you think?
I don't know if that's a red flag, but like I think that's important. Like
that's exactly
one of my
what
family members wants to have like a facelift.
Right. Go to like a facial expert.
Yeah. So you'd go to somebody who specializes in facial stuff.
I agree 100% with what you said. I don't think it's a red flag because, I mean, if I'm being honest, there are a lot of surgeries in plastic surgery which are considered bread and butter, which realistically any plastic surgeon should be able to do. But I do agree that, now there are specialists. I'm a specialist. I'm a breast and body specialist. I do way, way more breast and body surgeries than anyone close to me. By like a factor of, I mean, I know some of the people around me probably do 1/10 of what I do. And obviously the more you do something, the better you get. So I don't think it's a red flag. I do think it's a good idea if you're wanting a specific procedure.
Recommended.
Yeah, I think it's recommended. I don't know that's a red flag. So I was kind of on the fence on that one. Okay. Number 3, they don't have a lot of before and after photos.
I don't know.
I wouldn't like that because I want to see their work personally.
Yeah.
That's like if I go to get my nails done and I just tell them what I want, but I can't show them like an example.
Yeah.
I feel like it doesn't. I don't know. Just more reassured.
I do agree with this one. I mean, I don't know. It depends on what they mean by a lot. Do they mean like 20? Do they mean 500? I mean, I only print out like, I don't know, 15 or 20 pics. Usually I feel
like your Instagram posts, your business Instagram posts like at least once a week.
I always tell people if they want to see more, they can go to Insta because our Insta goes back for 13 years and we have befores and afters like that entire time. So I do agree with this one as long as like, I mean, if they said they got to have 1,000 photos, I mean, that's kind of silly. No one's going to print all that out, but I think it's important. Yeah. I think we're all on board with that. Okay. Number 4, price unusually low.
Yeah.
I do agree with that one because there is a lot of cut rate plastic surgery out there, and there's always corners cut when it's like that. Either they're not going to put you under anesthesia, which
Yeah.
makes it riskier. It's not a plastic surgeon doing it,
It's
which
in
is
Florida.
terrible. Yeah, it's in Florida. We got a Florida story coming up.
Oh my goodness.
I agree. I think that's like too good to be true.
Yeah.
Thing.
I always said, like, you don't want your plastic surgeon or your airline pilot to be like the lowest bidder, right? Like
Yeah.
the person who's going to do it for the least amount of money. Like certain things I think you do want to pay for experience. Okay, number 5, you feel pressured to proceed with surgery. So like high pressure.
Yeah.
I mean, yeah, I think that that's not good. I am super low pressure in my office.
Mm-hmm.
You know, I tell people, take your time, you know, think things over, call us back, come back in if you want to talk.
Yeah.
I do that mostly because, I mean, I just don't like to run a high pressure business, you know.
Right.
But I do think it makes people feel more comfortable. I think when people are pressured to do stuff, like that's like negative, don't you?
Yeah.
Say, I hate
I
that.
wouldn't like that.
I hate if I go to like look at to buy something, they're like, oh, you have to buy right now. I'm like, I don't think I'm going to buy it right now.
Actually,
Just because
no,
you
I
said
don't.
that.
Yeah.
Exactly. If they told me I couldn't buy it, then I probably would.
Yeah.
Sorry, you can't buy this.
Yeah,
What?
you
What?
do a consultation with somebody. This is what I can do for you, but I can't do it.
Yeah, I can't do it right now.
Yeah. So come back. No.
Well, actually, that comes to number 6, Sarah. No wait time for surgery. And then I also put on my own or consults. Is that a red flag if there's no wait time?
I don't know. I guess that means you're not like
So you're not busy.
Yeah,
So
you're not,
I'll
like-
tell you, I think it's a little bit of a red flag. It just depends because, so right now it's a slow time of the year and we're basically booked out almost through the end of September and we have most of November booked. So at this point, obviously, in my career, I'm very, very busy. I mean, if somebody can get you on like the next day, unless they say, hey, I had someone cancel, that does mean that they're not doing a lot of surgery. And so is the fact that they're not doing a lot of surgery a red flag? I mean, sort of,
mm-hmm.
right? I mean, you want somebody that's doing
busy, successful.
right. Like
Yeah.
patients want to come to them.
Mm-hmm.
So I kind of think that's it's not a huge red flag, it's a red flag. Okay. Number 7, actively upsell you. I mean, I agree. I mean, I think some people are more prone to do that. I think it's personally unethical for me as a plastic surgeon. Like if you came in and say, hey, I want to do my boobs, I'm like, oh, well, have you thought about getting rid of those love handles? Like, I mean,
Yeah.
it's a little unethical to me.
I feel like that's like mean.
Well, yeah, and plus, like, because I feel like that you have a little bit of power over patients. You know what I'm saying?
Yeah.
Because if I say as a plastic surgeon, oh man, you really should get rid of that because everyone notices that. Like they're probably gonna believe you, and and it's like you're using your power like for your own benefit.
Yeah.
So
because you're the expert.
right.
Yeah.
And I oftentimes have people come into my office and they say, "What do you recommend I get?" I'm like, "Sorry, I don't do that. Like,
Yeah.
you tell me what you have concerns about, and I'll tell you what your options are. Like, I'm not going to tell you what plastic surgery you need. Like, I'll tell you if I think you're going to, get a lot of bang for your buck,
Mm-hmm.
which is a way of saying you need this or you don't,
Yeah.
right? But you have to tell me, yeah. So that was their 7. I thought overall it was a pretty good list. But I actually had, all right, Sarah. I'm not going to put Brent on the spot. She's too new. Sarah, you've been around a long time.
Okay.
What do you think? Knowing what you know, do you have any other red flags that you would think of? And if you don't, it's fine. I'm not asking you to put you on the spot.
I think number 1, you already know what I'm gonna say. They specialize in like BBLs and things like that.
They
Maybe
specialize
not specialize,
or
but
like,
they
so for example,
advertise it a lot.
they do that, or maybe like super giant breast augmentation. Like they're doing things outside of the bread and butter. Yeah,
they don't.
Agree. I didn't even have
like
that
they don't do mostly natural looking procedures. Like they're like obnoxious.
I like that one. In fact, I did not have that on my list. So
yeah,
I'm gonna give you hats off. Brendan, you want to jump in there? I said I was gonna put you on the spot. I know you're new. If you got anything, what would bother you? Anything?
I was trying to think of something to like surprise y'all, and I can't.
It's okay. It's all right.
She was
cool.
like,
After
they're
you've been
really
here for like a
bad.
few months, you'll be able to rattle stuff off like Sarah did. Okay, it's cool. All right, I'm gonna give you my additions to this.
Okay.
All right, and some of these are pretty good. If they call themselves a cosmetic surgeon,
Okay. Yeah.
that's a red flag.
I remember you
because
saying that before.
no plastic surgeon would ever call themselves a cosmetic surgeon. They may say, I do cosmetic surgery,
Yeah.
but there is no such thing as a cosmetic surgeon. And when people are not plastic surgeons, like say they're, an OBGYN doing breast dogs, they call themselves cosmetic surgeons. So if someone calls them a cosmetic surgeon, that is a huge red flag. Also, this one's kind of interesting. If someone says they're like triple board certified,
That doesn't exist.
it does exist technically, but
But nothing to do with plastic surgery.
right, there's only one board for plastics, and that's the only board that matters. And so, like, I actually have my general surgery boards, but I would never advertise myself as a double board certified.
Uh-huh.
Like, it doesn't mean it doesn't make it my board certification in general surgery, which I don't even have anymore, but it means nothing about plastic
Yeah.
surgery. So a lot of times when people are not properly trained, I see this all the time when I'm like reviewing cases and it's not a plastic surgeon. It'll be like triple board certified, Ivy League trained.
Yeah, I feel like that falls under that like desperation.
Yeah,
That's
it's like overcompensating.
Yeah,
Yeah.
that's a red flag.
That is a red flag. Okay, this one's controversial.
Mm,
Office ORs.
uh-huh.
I'm just not a huge fan of office OR, and I'll give you 2 reasons why. And I'm going to preface this by saying I know some fantastic surgeons who have office ORs.
Yeah,
Like-
I think that's what I had
Legit?
my surgery in.
Okay.
But I was put to sleep. Like I was
Yeah, it
out.
was legit. Okay. So my two beefs with office ORs are, one, and we've talked about this several times
Mhm.
over the years. There is less regulation in those things,
Yeah.
and there can be bad outcomes because there's not any oversight or regulation.
Yeah.
And we've talked, like, remember the surgeon that didn't call 911
Mhm.
and the patient died
Yeah.
because everyone was like, call 911. It's like, no, this is fine. That would never fly like in a surgery center.
No.
So that is a risk for sure. Like it is absolutely safer to do surgery in a surgery center than office OR.
Yeah.
But the other thing is that's where non-plastic surgeons have to be, right? And so there's a chance that if it's an office OR that it might not be a real plastic surgeon
Right.
because that's their only option. They can't go to surgery center. That one's a little controversial. All right, plastic surgery mills. You
Mm.
know, the places where you're going to,
Like a
Sonobello
franchised place.
or franchise plastic surgery. That's a huge red flag. We've talked about that. If they encourage medical tourism, so like say even like a legit plastic surgeon, like say they live in Miami,
Mhm.
and they're like, oh no, come on down and have surgery with me. I think that's a red flag. I have people contact me on social media about coming out, and I almost try to talk them out of it,
Yeah.
unless they live close
Yeah,
enough.
like unless you're like, do you have relatives here?
Yeah, the problem with it is, it does decrease the doctor-patient relationship a little bit, but also like if you have any issues post-op, then it's problematic.
Mhm.
If somebody comes from, we had one lady a year or so ago that came from New Mexico, and I had the whole conversation, but they lived out in the sticks in New Mexico, and they're like, "There's nobody in between us and you that we feel comfortable with. We do our surgery." I'm like, "Sure." So we do her surgery, and she had a very minor issue afterwards, nothing big, but she had to like drive back a time or two so I could just check her to make sure she was doing okay, and not put burden on them. And thankfully, like her issue was
Mm-hmm.
almost nothing, but it did put like a little bit of burden on them. They had to come back
Yeah,
for me to check them. So
that's wild.
all right, the last one. If they do not spend time with you in the consult, I think that's a problem. I hate that when, and I have people tell me that all the time when they do multiple consults with different doctors, and they'll say, the last doctor I went into, I saw the doctor for like 5 minutes and that was it. I just don't think that you get enough information from the patient to really kind of sort out what they're looking for. And I think
Yeah.
there's an increased risk that, you may end up with an outcome that you're not.
Getting a plastic surgery is kind of it's a
It's a big
surgery,
deal,
but then it's
right?
also
Yeah.
elective. So it's
Yes.
like,
Yeah, there's no rush.
yeah, so
Shop around.
they're not doing a good job if they're not there trying
Right.
to, like,
Yeah. Oh, I see
yeah.
what you're saying. Yes. Yeah, I think that it's very important to spend time with patients to kind of really nail down, like, okay, what is it that they're after, and make sure that you listen to them and not just jump on the first thing that they say.
Mhm.
Because a lot of times, a lot of patients come in and say, "I want a breast dog," and then you talk to them, and they really don't want a breast dog; they just want a breast lift, right? But if you like
Mhm.
don't take the time to talk to them, then you end up giving them a surgery that
Really didn't.
they really didn't want. They asked
Yeah.
for, but they didn't really want it. So.
Yeah.
Yeah. All right. Let me recap this one, Brennan. Today we were talking about red flags in plastic surgery, and this came from a Huffington Post article, which is pretty interesting. It talked about things that are red flags if you're having a plastic surgery consult that you should be nervous about. And so I thought the article was good. We went through all the ones they listed, and we added our own. Some of the highlights: making sure that your surgeon is board certified by the American Board of Plastic Surgery. I think that is definitely number one. Talked about other things. So some of the ones I added were things making sure that they're not calling themselves a cosmetic surgeon, because that typically is somebody who's not a plastic surgeon. Talking about if they spend enough time with you, if they specialize in your procedure. So it was a pretty good list of things. We went through all about, what was it, 13 or 14 things or potential red flags. If you want to learn more about those, then check out the episode. It's a good one. So, okie dokie.
Red flags.
Red flags. I think that was a cool one. I don't know if we've ever done that. I want to say maybe we have.
I think so.
Have we? I wonder if it would be funny to watch both episodes and see if they're similar. They would have
Maybe.
to be.
I'm sure they are.
Yeah. Well, this one we were kind of reviewing someone else's article, so
Yeah.
I think it was good.